one of the things that I do as part of my role as a navigator and is use motivational interviewing and coaching, which is a little bit of a different approach to survivorship care. When individuals are going through treatment, and we all do it and we need to do it, is to provide education as to this is what you need to expect. These are the signs and symptoms you need to report to us. Set your calendar or your alarm when you need to take this medicine, or if you need to provide rinsing your mouth to prevent any, mucositis. But once they finish that active treatment, we've controlled their life, so to speak, for such a long period of time, is, give back some of that control to the patient. And what I mean by that is perhaps an individual may have taken a leave of absence from work, or maybe have reduced their hours because of the fatigue and side effects that they're experiencing. And now, once we assess them as part of their survivorship journey. So we're asking them about their long-term late effects. We're asking them how their fatigue is, how they're managing financial toxicity. So if they share with us, wow, I'm really fatigued, and we know that they are going to return to work on a more full-time basis, is ask them, I see that you're concerned with your fatigue. I also know that you took some time off from work. How are you managing that? How have you thought to incorporate rest periods or exercise, or have you? So, you really allow them to, find where they need to go as far as in their survivorship journey. And rather than telling them, oh, you need to exercise more or start a program in walking, you help guide them and give them the education is, not uncommon to feel fatigued. We know that exercise is a great way to reduce fatigue, and then just help them, develop goals. So they're providing them, or they're developing their own goals. And our role as a clinician at this time is support them on their goals. We know exercise is important, but individuals need to find their own way to incorporate that. So we're helping them guide and providing that like coaching. So, okay, we're going to do what, 10 minutes, 10 minutes of walking a day? Okay, maybe we can touch base in a couple weeks to see how that's going. Or, share with them, here are some resources in the community you may want to also incorporate. But on the flip side of that is some of the individuals we have when I talked about assessing them, is also their social determinants of health. So if they live in an area where there's not sidewalks, is it really safe for them, to exercise? Or if we're sharing with them, there's some free exercise programs at the, support group that's not too far. If they don't have transportation, how are they going to get there? So we really need to look at them holistically, as you mentioned, and find out, where they are. Look at those community resources and see how we can help them on their journey. And sometimes it may be partnering with community agencies to bring some of those resources closer to where individuals live, or maybe it's partnering with faith communities like churches and things like that, that may be more centrally located for individuals to get to a little easier, that they can have that same access to care that they need to. And then that way they have their community support. That's all part of the importance of, getting holistic care. You need that support from your community, your friends, your families, your faith communities, if that's important to you as well. So it really takes a village to help individuals get back on track after they've, completed active treatment. And in some cases, we know, both of us, that individuals that are living with advanced or metastatic cancer also need access to these resources as well. So, this can help individuals regardless of where they are in their cancer journey.